So the first thing I'm going to do is we have a plaque for Sonja to thank her very much for coming and doing this for us today.
Thank you.
It says CCVI Distinguished Scientist Lecture in Cardiovascular Research with the date, and she is our keynote speaker, Dr. Sonja Fonfara. And this is
Thank you. Thank you. Thank you.
and you got
And my box. Thanks.
So I'm going to do a very brief introduction for you. So Dr. Sonja Fonfara is a board-certified specialist in companion animal cardiology from the European College of Veterinary Internal Medicine, ECVIM, and professor at the Ontario Veterinary College, University of Guelph. Her training includes a doctoral degree in veterinary pathology from Germany, specialist cardiology training in the UK, and a PhD with academic appointments in Liverpool, Bristol, and Helsinki. She currently serves as chair of the ECVIM Cardiology Specialty, co-editor-in-chief of the Journal of Veterinary Cardiology, and most recently she was awarded the Research Chair in Feline Health with research focused on feline cat cardiac remodeling and hypertrophic cardiomyopathy. And so it is my absolute honor to have Sonja join us, and let's give her a hand. So however you feel comfortable with that.
Does it work? Yeah. Okay, perfect. Thank you for the introduction. The summary took part of my talk already. Okay. So I want to talk about a day in the life of a veterinary cardiologist, and I was asked to cover a little bit my career path, what we do as a clinician, and my research, and I will do this in the next round about 1 hour. So how did it all start? You can hear already on my accent, I'm not a native speaker. So where I'm originally from is from Europe, and then particularly in Europe, I'm from Germany. And from Germany, I'm from the North Sea coast, here high up, and that is how it looks like there. So it's a very flat, and there are a lot of cows and farm animals. So my original idea was to become a farm animal veterinarian, so to do, not a farm animal veterinarian. So I spent a lot of my school time driving around with a large animal veterinarian because that is what I wanted to do. Vet schools, similar to Canada, in Germany, they are also acknowledging that Germany is a lot smaller, only a few. So it's Berlin, Hanover, Leipzig, Gießen, and Munich. And I got into vet school in Hanover. So I did my veterinary degree there. And at the end of the veterinary degree, a friend of mine, we were both thinking like, learning a little bit more about diseases, maybe looking a little bit into research. And we were also thinking, the job, we both wanted to do veterinary medicine in a practice. I think that's how we all start. We thought like, okay, we do this for the rest of our lives. Let's do something slightly different first. And we found a supervisor in pathobiology, and he relocated to Gießen. So we went to the Justus Liebig University in Gießen for the doctorate degree. And towards the end, the aim was always to do a clinical practice. You get a bit like, you forget everything you learned at university because, as you all know, research is very different to what you do clinically. So I started volunteering initially in a small animal practice and then working in a primary care practice in Eschborn, which is next to Frankfurt. Now it's part of a big corporation. At that time point was still just owned by one person, and it was a really good first place to learn because he pushed me a lot to become the best I can do, and then also he started planting the idea of doing a specialization, because to that time point, and I went to vet school from 1990 to 95, Specialization in Germany was not even a thing, so I haven't even heard about it or considered it. And he was the one who said, like, come on, specialization is the future. You should think about it and you should start looking into doing it. And at Gießen, they have a veterinary cardiology service, so I spent some time there. So I did this for a few years, and then, and you will see my career slightly random, and then the position came up in the north, again, back to the north of Germany, which was here, again, at the coast, and it was a research center who does research with marine mammals. So I thought, like, oh, that's very cool. So my idea was like, oh, you know, you travel around with a boat and then you look at seals. The typical seals in the North Sea are harbor and gray seals, and then harbor porpoises. And I thought, like, oh, this is what I would do. So you can imagine it's not like this at all. What we did twice a year, we went out and we caught seals and assessed their health. But primarily, it was a very smelly job because the main work was like dissecting, you know, stranded or washed on bodies of harbor porpoises and harbor seals who died to find out why they might have died. And you can imagine most of them were quite rotten. And the other part of it was building a molecular laboratory, and it was based on the research work I had done before. Well, I was a bit, so all the research I still then did with the University of Hanover, and it was quite frustrating, or I often felt quite inappropriate or not being able to do a proper job, because the level, when you talk with them, they're, you know, like some of the professors you work with, their level and their standards of research is really high. So I always felt slightly incompetent meeting with them, so it was slightly dissatisfying. So I again contacted my previous boss, because the idea was still like doing clinical medicine, and he said like, oh, you should look, you know, you wanted to specialize, look more into that one. So then I thought like, okay, the only other language I speak to, again, in Germany was not an option, it just didn't exist. So I thought like, okay, the only other language I'm speaking is English, and only a little bit. So I contacted the different universities who do or offer specialization in England, and then I was lucky enough to get into contact with the professor at the University of Liverpool. And this is one of the moments in your life where you think like, oh, now I'm at the right point, at the right place, because the lady who did her specialization in cardiology at that time point, she was pregnant and they needed a 6 months maternity cover. And I had originally thought like, oh, I do 6 months because 6 months I can fund myself, and then I go back and, you know, apply what I've learned there. So it's thinking like, okay, 6 months paid is better than 6 months unpaid. So I went to Liverpool and I really, really loved it. It was so exciting working with people who are all specialists in their area. They knew their stuff. The detail of level you are learning when you do specialization, you know, after you have done your vet school, the level of detail you are learning is super exciting. So I got really excited about it and then wanted to do something similar. So after the 6 months, I then applied there for a rotating internship and was lucky enough to get it. And then after that one, the lady I did the maternity cover for had completed her residency, so I did apply for that position and also was lucky enough to get it. So I did my residency or the specialization in cardiology in Liverpool, worked there as a lecturer for a while, and then you can see I'm slightly unsettled. So in the meantime, a friend of mine, she became the chef of the pathobiology department in Helsinki. And because, you know, with the research background I had, I always continued research a bit like, and then just you know, what I've done before, applying it to the heart. And then she said like, oh, you can take this work and then we can, you know, see that we can make a PhD out of this one. So I moved from Liverpool to Helsinki and did there my PhD. And because I had done work already before, so that's why the time frame is slightly more limited. It was 2012 to 15, so it's not like PhDs usually, as you will be fully aware, take longer. And then I, after this period of time, I moved to, I applied for a senior lectureship at the University of Bristol. Langford Vet is a hospital which belongs to the university, and worked there as senior lecturer. And then you can imagine you will have the same, have up and downs in your job. So at that time point in between, there were a little down. So when the position in Guelph came up, I thought like, oh, I apply, and then as you will learn in your career, universities can take time. So I applied, it took a while, and then I thought like, okay, now I'm not even as keen anymore. But I thought like, it's one of these things where you feel like, okay, if you don't do something, you might regret it later. So I went and had a look and did my interview, and I really, really loved it here. I loved the team, I loved the size of the university, or the Ontario Veterinary College was really nice, and I really loved the group and the possibilities you can have here in Guelph. So now I really wanted the job. Again, it took a while, but yeah, this is how I ended up here at the University of Guelph. So how did I got there? It's a bit like you can see already on this slightly random. I get very easily excited, and I'm curious about a lot of things, and then I'm very spontaneous. So the problem is often I make a decision and then think about it afterwards if it was a smart idea. So a lot of these decisions were made like, oh, I thought like, oh, this sounds super cool, so I'm doing it. And then afterwards I thought like, yeah, not so sure if this was the smartest. But at the end, it's, yeah. So the other thing is like really, wanting to improve in something. You can imagine the times when I worked at First Opinion, I went home in the evening and I thought like, maybe I missed something, maybe I don't know something, and I could have done better for the pet. So there was always these like, thinking like, I'm not good enough, so I want to be better. And then I mentioned my mentors already, who really supported and brought even the idea up in the beginning to look into specialization. I also didn't really have a fixed career plan, so with the forward and backwards, I went to, started vet school in 1990, and becoming a full professor was in 2024, so it took me a long time. If you know what you want to do, you can do it a lot faster, but it took a while first to know the options of what you can do, and then also, if you are possibly in your life a bit more organized, you can do better than I did. And then for luck, you have to be lucky in a way also. I don't know if I nowadays would get into Liverpool Vet School, but at that time point was one of these moments where I was possibly lucky to get in. The other thing which I the other thing what I often got told is that it doesn't make sense what I do. So I did vet school, and then everyone said like, oh, but you want to do clinical practice, why do you do a doctoral thesis? That's a waste of time. And then with a postdoc, they said like, oh, if you do research, why did you do clinical practice? What a waste of time. But now, I'm in a situation where I can really use what I've learned during research and apply it to clinical research. And, a lot of, if you only do clinics, in a way you are limited, and you might not even think about other things you learn if you do primarily research. So for work, it's really, I'm not the smartest person, so I have to work my ass off, for getting, for learning and for becoming better. So it's like nothing is given to you. You can achieve whatever you want to achieve, but you really need to work for it. So, and it's, it's all your life in a way. They always say like, oh, you learn all your life, and that's possibly what you do. So you do vet school, you do a doctorate, you worked, then clinics, everything is new, then you do a postdoc. Specialization to learn to the level is a lot of work. The PhD, and now as a faculty, again, we always try to be on the top level of the knowledge and what is published, also to be able to teach the students and to provide optimal care. So what was harder, different, and surprising? And I just want to, these are typical stereotypes. You can imagine they're not just men in Germany and in the UK, but this is just a nice reflection of how male-biased our internet still is. I looked for other examples, and for example for females, and the examples are just very non-flattering, so I stuck with what I found. So what is different? And it's like you would think like, you know, the countries are all very similar, so it can't be as different. But it's surprising, it's a little thing how different it is. So in Germany, like, you know, if you tell someone like, I do this and I'm there at 8, they're usually there 10 to 8. If they say I come around on Saturday, they will be there on Saturday. So it's a really strict, they have their rules. The other thing, they're truly grumpy. I always thought, like, you know, growing up there, I thought like, oh, that's not true. And I went to the UK and they said, oh, the Germans are so grumpy. And I said, like, that's not true. No, they are. Now, after I've been spoiled living in the UK and living here, now when I'm going back, my gosh, they are rude and grumpy. It's true. For the UK, it's again like, you know, coming to the UK, and it's really funny. So if you grow up here, you walk on the right, you drive on the right. In the UK, it's the left. So if you walk by in a small corridor, and in the beginning, it was really not funny, but interesting, because I always bumped into people because you walk on the wrong side. And then the other challenge you have as a German is, you know, it's getting used to these, hello, how are you? And you try to get it in whilst you are passing someone else. So at the beginning was usually like, hello, shit. So it's just like, and then, you know, I was so proud the first time I managed to say, hello, how are you? And get it done whilst the person was still more or less on one level. So small little things which are different. Finland, I mean, one big thing is the language. This enpu suomea means I don't speak Finnish. They truly do business meetings in saunas. It's a bit awkward. But the language is like, imagine you are in a big supermarket and you try to figure out, because they sell yogurt also in carton boxes, which one is milk and which one is yogurt. Impossible. Sometimes it's helpful because Swedish is their second language. They might put this one on it and then you can try to figure it out. Or being with another lady who has a peanut allergy, trying to figure out which cake might have not peanut. So it is a bit of a challenge, but it's a super nice country. And then for Canada, you're possibly all too young to know them. I'm living here now for 10 years, and I only learned about Bob and Doc McKenzie a year ago. Now, you know, getting to know Canadians who are born and grown up here and at more or less my age group, so that's why. But it's my highest respect. They are so good, and so they did little snaps or little short periods on television and did a really nice reflection of the Canadian culture. And so if you, YouTube them or something, I love them. They're really good. Canada is the same. It's just like, so first the cars are truly all a lot bigger. So I really wanted a truck in the beginning until someone told me, oh, then you need weight in the back. And then I thought, okay, I start a bit smaller then. So it is like, or then, you know, little things like termites. I'd never heard about termites. I knew they existed, but not that there might be a problem when you try to live somewhere. If you, LG and Samsung as a washing machine, they do computers, but not washing machines. So it's just, you know, small things which are not a big thing that there might be different, but there are differences. What was harder? Language I said already. And even with the English, my English was not good. Oh my gosh, I was exhausted in the beginning. Coming to the UK, everything is on English. You try to phrase the sentence in your mind, and then the communication is already, whatever, half an hour or progressed to that's not relevant anymore what you had tried to say. Your family and friends, you leave them behind. And it can really, oh my gosh, can feel horribly, horribly lonely. That's my getting back to my spontaneous decisions. The first weeks or months in Canada, I felt horrible, horrible. Because in my naivety, I thought like, oh, I worked in the UK before. I thought like, oh, you know, if I fly, because where I'm from, I always have to change planes. If I fly 1 hour and 1 hour, or if I fly 1 hour and 8 hours, it's not a big difference. It's a big difference. Also with the time difference. And people warned me, but again, like I know better. So yes, no, it is a difference. So family and friends, you know, things, my family still lives in Germany. If something happens in the family, or, you know, my brothers, they now all have children. I hardly know them because I'm here. So you leave them behind. You miss important things. You leave friends behind. It can feel really lonely. Exhausting, I brought it up already a little bit. and you always, or at least I always, you feel like an idiot. You start somewhere new, everyone else knows the clinic, they know the computer system. It's just little things, where the syringes are, where the medication is. You are the only one who doesn't know it. You feel like an idiot. I always did. So it is challenging and it is exhausting. But the other thing which I always then, when I have these moments, need to remind me, it's never boring. Oh my gosh, you know, other people, and I feel myself really lucky in that regard, that I like so much what I do and that I do such an exciting job, and I will share this in a moment with you. It's like, you know, who do other jobs and do it from whatever, 9 to 5. It is, they, you know, and you're not really enjoying what you're doing. What I'm doing, or if you do something like this, it never is boring. And then the other things, you meet so many exciting people. Oh my gosh, and I will show you a bit on the following slide also where connections are really helpful also down the line. Okay, so why cardiology? It is a very common common disease. So we differentiate between the congenital ones, so the dogs are born with, and the acquired ones the dogs develop, or cats develop during their lives. And some of the breeds have acquired cardiac diseases, and they get to a prevalence of 60%. So it is really common. The other really nice thing is you can make a difference for the pet. So if a pet's heart is not working properly anymore, if you address it and you treat it, they feel so much better. So it is really satisfying. Then one area to be good in, this is these, like, because I did feel in, you know, during the earlier years so inappropriate and incompetent in so many moments that I felt like I at least want to have one area where I know I can be the best or do the best, provide optimal care, do the best I can do. The nice thing about cardiology, it makes sense, which is super nice also. You can imagine, you know, it's all physics in a way, pressures in one, if it changes or if there's a leakage somewhere, flows will change, so in a way it makes sense. We have different diagnostics, and I will show you a few on the following slides, and then you get really pretty images. So ultrasound is our primarily diagnostic tool. This here is a heart, and if you put color on it, and there are leakages or something is obstructing, like the green here, which is not normal, it's super pretty. Usually if cardiologists get excited about pictures, it's not very good for the patients, but it's super pretty. All right, so clinical work. So what do we do on a daily basis? So introduce you to our patients. So we have dogs, and you can see already they range quite a bit from under 1 kilogram. This is something we see typically, these smaller breeds, but they can reach to over 80 kilograms. So it's quite a range of dogs we are seeing. Then cats, our little stars. So they come in different forms also, so haired or naked. Then some are a bit longer or shorter haired. So the kitties. And then how do we keep them happy? And what we work with, and you have seen it on the other pictures, we could see it already a bit like, so we like using towels, we work with pheromones. If we, you know, they all get treaties, and the good thing about cardiology is also we usually don't hurt them. The ultrasound I will show you in a moment is not painful, and it's usually, because we work in the dark, so it's usually a nice and quiet environment. So we try to convince them with treaties to be happy for the cats and then also for the dogs. And you can see the excitement is not just on the dogs, but also on us, on the veterinarians. And this here is Claire. She is one of our residents. So what it means, she went to vet school, did vet school, and now also does a specialization in cardiology. If they stay for longer, they can bring their little toys, and then whatever makes them feel comfortable. So if they are more happy being lifted up, they can be lifted up. It's not possible with 80 kilograms, but yeah, just, you know, making them feel comfortable, happy in the environment, makes everyone happy, not just the dogs. fully acknowledging that not everyone is always happy, so the cats sometimes are grumpy, dogs cannot be as excited, and it applies to our students also, so we try to make it nice, but not everyone is always excited about it. So what do? We start with physical examinations, and again, trying to accommodate the tiny ones to the slightly larger ones. So what it means when the patient comes in, and we start with asking the owners of what they have observed. The thing is, as you know, our pets can't talk, so we rely a lot on what owners tell us. And then we look at the patient, and then with the auscultation, we get already a lot of information. Like, how does the heart sound? Does it sound normal? Is there a murmur? Might there be an arrhythmia? And based on this, we do following examinations I will show you in a moment. These are two more of our residents. This is Tobias Orbanschitz, our third-year residents. The program, the specialization is 3 years. This is Essie. She is Connections from Finland. She is also one of our residents. So this is how it looks like. Ultrasound of the heart, echocardiography. What we do, they're all a bit dark because we're working in the dark. So the patient is lying on their side on the table. It's like the good thing is, you see the table is nicely cushioned, they have blanket. The good thing is, like by them having them on the table, the heart drops to the lower side in the chest. And then what you do is you have the ultrasound probe here from the bottom, and because it's then lying on the side, you get good pictures. The cables here are the ECG, so the conduction, the heart rhythm, which is recorded at the same time. And you can see again, we rely a lot on students helping us out, and also when they watch it, we can talk them through and show them through them changes. This is Claire again with also one of our patients. Usually the dogs and the cats also, they relax as soon as they realize nothing is really happening. So and this is what we get. I put the normal heart here on the top. So that is what we see on ultrasound. We can see this is the left side of the heart, the left atrium, so the forechamber, the left ventricle, and the right side of the heart. So what we want is a normal shape. This is a normal shape and a good normal contractility. And then this one here is an example of a diseased heart. In comparison, left atrium is a lot larger, and the ventricle also looks wider, and also just subjectively, there's a lot more force, a lot more contractility. So ultrasound really shows us like where the disease is, how severe it is, and gives us a bit of a better information. Okay. So for X-rays, that's the other imaging option we are having. And again, I put a normal X-ray here on the top. I cut the sternum, which if you talk to an imager, they won't like it. So you should always try to get the complete chest on it. So this here is a heart. So that's fine that it is there. And then the lung is, as you will know, full of air. So lungs should be just nice and dark and black like it is here. So if you have something like this with a lot of white on the X-ray or on the chest in the dog, there is a dog, it's never normal. So this again helps us to identify the severity of the disease and help us getting an idea what we need to do. If we hear an irregular heart rhythm, again it's all based on what we do initially, listening to the patient, looking at the patient. We we investigate this further. Or, for example, our colleagues in anesthesia, they have an ECG, and you can imagine these here are normal beats. Having long pauses in between is not normal. And then what we do is we take a normal ECG, so which records the rhythm and the conduction through the heart. And then this is just an example to show you what is not normal. So these are normal complexes. These ones here, they look like as they should be. And then you have occasionally abnormal ones here in between. If you only have a few abnormal ones, it doesn't really matter. But because you see the patient only for a short period of time, what we have the option of taking an ECG for 24 hours. So this is how it then looks like. They get a little jacket, and I will show you on one of the following slides how the device itself looks like. The device is sitting here on the recorder is here on the back. And then what we get is 24 hours of a heart rhythm recording. And I will show you an example how this might look like. So this is an example of again, a heart rhythm. And then it's like this here, the first 2 rows are completely normal. And this is how the patient might show to you in the clinic, but then an owner tells you like, oh, sometimes, you know, there are wobbly events. This is all you see. And then you think like, okay, there's nothing abnormal. That is where the 24-hour ECG comes in, because here there's a long pause with no beat at all. You can imagine no heartbeat, sure you faint. And this one was 18 seconds. So 18 seconds, no heartbeat, means you possibly faint, and then the heart here kicks in again more on the bottom. So this helps us narrowing down a bit more what might be going on with this heart rhythm or the heart rate also, and helps us to manage these patients. So what do we do? It's commonly medical, so it's commonly tablets we are giving to treat the disease. Unfortunately, most of the diseases we are trying to address and we treat are progressive diseases. So our priority is really a good quality of life. So we want to have the dog and the cat the best life, because we know it's limited, the best life they can have despite having the disease. And with it, hopefully, we prolong also a little bit the life, but the priority is really quality of life. The congenital cardiac diseases, there are a few, and these ones, so, which the dogs and cats are born with, and these ones, some of them we can fix. And this is when cardiology goes into surgery, and I show you the picture from the back because I will show it to you the other way around in a moment. So you need anesthesia, the patient, puppies, so they're usually small, is here on the table, and then you have 2 cardiologists here which look or do the procedure. And that is how it looks from the other side. So now they have the 2 cardiologists here, and we don't really do open heart surgery. That's what the surgeons do. So what we do is we usually access a vessel either at the neck or at the leg. And then to see where we are, we have these live x-rays, so fluoroscopy live x-rays, and to see where we are, so we can then, have a look. So usually, so it's a movie, the heart is beating, and this is one of our catheters here in the heart. And you can see it's only a gray silhouette here and there. This is a different cardiac disease, but a gray silhouette of the heart. So to really get a proper picture, what we often do is contrast. So we have this, our catheter again. We do a contrast injection, and then it delineates the chamber of the heart. And you can imagine that this narrowing here and the big bulge behind it is not normal. So this was a congenital cardiac disease in a dog. And when we can get rid here of this narrowing, that means the dog is possibly doing a lot better. You can imagine if you have a narrowing in the output of your heart, your perfusion is not as good, your exercise is possibly not as good. So trying to work on this one. This here is an ultrasound probe, which also helps us to image it, which sits in the esophagus of the animal. So this again how it looks like. So it's usually really just, it's very boring to look at it from the outside, a very small surgery area. People trying to see something. So that's why the fluoroscopy, the live x-rays are what we work with. Very happy cardiologist if the procedure goes as we want it to go and everything is fixed at the end. These are again our 3 previous residents. James is still doing a PhD with us. I will show one of his projects a little bit later. And then Ananda and Andrew, they are now cardiologists in Toronto. So because under general anesthesia, so the puppies are usually flat afterwards, but we are happy because we have fixed him. And this is an X-ray of one of the other procedures we are doing, so one of the other congenital cardiac diseases we can fix. Here's the heart of the dog, and this is a plug we put into the heart to close a connecting vessel which shouldn't be there in the first place. And like this, it's really nice because if we don't do anything about it, they are usually present to us within 1 year of their lives. If we don't do anything about it, they are dead, develop heart failure and are dead within a year. If we fix them like this, they have a normal life quality and a normal life expectancy. So now they can be treated like normal dogs, which is really nice for us because usually what we do is buying time. So I mentioned already our aims is because we feel we talk for our pets, they can't tell it, they can't tell if they suffer. So our aim is improve quality of life, hopefully quantity of life a little bit, provide guidance to the owner and care to the pets and the owners. And what else we do is we teach, because with our knowledge we want everyone to do the best they can do. We teach students, undergraduate, postgraduates, we teach colleagues who are not specialized, so help them out, and we teach us because we want to, be able to always provide the best care and are on top of our knowledge. Again, this year is Toby again, and with, trying to make our patients comfortable. So these are some of our students, undergraduate students who rotate through cardiology. So it's not just lectures we are giving. They spend time with us on clinics where they take responsibility for the patient. So they do the physical examinations with us. They develop a plan and they help us managing these patients. This is Toby, you have seen him already. So it's not just learning how to, make little kitties happy, one of our undergraduate students, but also we teach them and we train them in cardiology. And then hopefully at the end, this is Ananda again, they have an exam at the end, they pass the exam, and then they are cardiologists who then in the future provide optimal care to the pets and teach other veterinarians to become cardiologists. This is from a conference in Europe. This is a room full of cardiologists. So just reminding, we also learn all our life and trying to be on top of the development and state of the art. And this year was a CE event for veterinarians who do primary care and also want to refresh their knowledge in cardiology. Okay, so briefly research, what we are doing in research. And I mentioned already briefly in the beginning the collaborations, with all these wandering around in the world and people telling me like, doesn't make sense really not to be consistent. So this is from the time when I worked with the marine mammals. Afterwards, when I did cardiology, but that was still from the UK, now the distance is a little bit big, we try to apply this to seal pups. So what happens is once a year they, with events, either weather events or whatever noise or something like this, it's usually during the summer, they might be abandoned from their mums, and then they, would die if they don't get rescued, and then they get collected by specifically trained personnel, and then here in the seal station, it's Friedrichskoog, it's Station in Friedrichskoog, it's one of them, they then get, made sure that they're healthy, and then they gain weight and until they're safe enough to be released back into the wild. I show you on the following picture how they look after wild. So we did ECGs in them. So this one I've introduced James already briefly to you. So now with the connections we have, again, with our international connections we have. So James is now doing a project with sea turtles, bicort sea turtles, who also get diving sickness. So they might have bubbles in the heart. So they also get rehabilitated and then released, but no back into the wild, the effect of this disease on the heart. So he does ultrasound and ECGs in the heart of these sea turtles. And then this is the example of, and you can see how the seal pups look after they got nicely made fat and ready to be released back into the wild. Looks a lot better than the thin little ones from the beginning. So this is how this 24-hour ECG is placed. It's the same in dogs with little ECG patches on the chest. For the seals, you need it watertight, makes sense. And then we just bend it or use normal wet wrap to bandage them. And then they got released back into their little group, and could swim with it. And what it gave us is, again, similar to what you did see for the dogs. So it's an heart rhythm and a heart rate, which we can then use to have an idea of what they are doing. My primary research now, and you have possibly got a bit of an idea already that cats are my favorite. I like dogs too, but cats are special in my heart. So the research in cats is like how the heart changes with age, then with hypertrophic cardiomyopathy. I know Tammy told me she has mentioned this already to you. Then if there are sex differences, and you can imagine in veterinary medicine that's usually ignored because most pets are neutered, but we know now, and it makes sense, isn't it, the cells are still different, that there are differences, and then also how systemic diseases influence the heart. So why hypertrophic cardiomyopathy? Because it is the most common heart disease in cats. It has a prevalence overall of 15%, but when the cats get older, around 9 years, it even increases to 30%. So it's a disease we really commonly see. And I will show you on the following picture why diagnosis can be challenging for us. So diagnosis, we are not great in this. Prognosis is poorly understood. So some of you know, you see the same patient at the day, or you see two patients with the same presentation, and one, you know, develops progressive disease and is dead in a year, and the other one lives another 10 years. And we have no good idea why the difference is there and why they so differ in their presentations. So understanding this better is the driver of our research, and then hopefully down the line being able to provide better diagnosis, better management, and better treatment. And the nice snippet about it also is it resembles human disease, so it's also a very common disease in humans with a prevalence of 1 to 500 people who will get it, and they have similar challenges. They're a bit more advanced than we are, but they have similar challenges as we have. So this is how we diagnose the disease. So what we do is we ultrasound the cats, and then we measure the left ventricular wall. And this is just a part here of the left ventricular wall, and this shows already slightly the challenge. So the left ventricular wall has this more squared appearance, and then there's this extra bit. So and it will make a difference what you measure. So this is, and so what we did is we took the same picture, send it out to different cardiologists, to people who work as a cardiologist, and you can see how different they measure it. So this person here measures the complete wall and gets up to 6 millimeters, so 5.6. This person only measures this part and measures with it around 3 millimeters. So it's a huge difference, and that is how where the challenge is. We don't really know what we do and what we measure, which makes it tricky for us to diagnose or to know what's going on. So what do we do to become better in this? We do clinical work, so we do an ultrasound in the cat, so you're not cute little kitty, where we do an ultrasound with it, and then we take blood samples, and when a patient has died, so we don't recruit or kill patients for this, we ask the owners if we can have the hearts to analyze this further. And then when we get the hearts, what we do is we take pieces out of it, and then we look for genes which might be activated, for regulators of these genes, which will then hopefully help us to improve the understanding of what's going on. And then we also look at how the structure, the morphology of the heart looks like. And this is a collaboration with the University of Zurich. So what we get looking into the genes and the microRNAs, which are regulators of these genes, and if we compare normal cat hearts, so cats which didn't have cardiac disease, and cats with hypertrophic cardiomyopathy, if you do this analysis, you get these kind of plots. So this shows how many genes are upregulated and downregulated, and then there's softwares for this who then put it all together, and with developing these networks, hopefully will help us to understand better how it all fits together. You can see there are quite a few students involved. So Jessica Joshua was our previous PhD student. Ritu Verma is our current PhD students working in this area. Megan Allen, a previous master student. And then we have at the moment Hirab Bra and Jessica Hazelhurst as our current master students working in this area. So then in Zurich, I mentioned they do the histology. So what they do is they take the heart, cut it into slices, and then you can see the different cells, how they look like. So cells, so these are the muscle cells, and then there's connective tissue here in between, and this helps to identify what might be going on. There's the option of doing different stainings, which again more illustrates specific things you are looking for. And this was, again, doctorate and PhD work of Sarah and Joseph. And at the moment, there's a postdoc, Francesco Prisco, and he puts it all into a three-dimensional picture, because this is just a cut, and he is now working on, putting it all together and then getting it three-dimensional, which will be super cool. So next step would be putting it together. So the idea is really saying like, oh, if we see this one on an ultrasound, that means this is what is happening in the heart, which will help us to give the owner, inform the owner better, and for us also how to manage the patient to say like, okay, this one we need to see again in 2 months, this one we only need to see in 5 years or never ever again. So improving the understanding. Then mentioned already, we now started to realize it is possible even in veterinary medicine important to look at sex differences. So maybe the female cats present and progress differently to male cats. The moment we don't know because no one has separated them out. Blood markers, so really saying like, okay, what do we see in the heart? Can we find it in the blood? Which would be super helpful to, if you just take a blood sample and measure it, that would be great. And then treatment. At the moment, we don't really have a treatment for the disease. So the only thing what we do is when they're in trouble, so when their heart starts failing, then we can treat it symptomatically. But it would be really nice to have something which either slow down the progression of the disease or something which might even prevent it. And then, yes, I mentioned already human medicine is, the human disease is similar, so the work might have a translational aspect also. So why does it matter? It's important because at the moment we don't do very well in diagnosing it properly, informing the owner. We need to know what it means, so what is truly normal, and then that we know what to do. I mentioned the treatment, and then with it down the line, if you can tell an owner or a pet, you can imagine cats don't really like to go to vets. What we do at the moment, if we are unsure, we just say we need to see you again. If we know better, we can just say like, we need to monitor you, but you don't need to come back again, which will help also animal welfare because then they don't need to come again. Again, what is involved, I haven't even mentioned like you need funding for research. So that is also another aspect of the work. So you try to get funding to do. So we have at the moment government funding, NSERC, the Pet Trust might have heard about it, and we have the Feline Health Research, which helps us funding our research. And then just to introduce you again, this is Agavan. She was a previous student, undergraduate student. She is now going to vet school, so she will become a cardiologist, possibly not, but a veterinarian at least. Dr. Sherry Rehab, she is my colleague. She is the other cardiologist at the OVC. Then Verena, she is a Brazilian veterinarian who did cardiology, who also wants to specialize. She is at the moment a rotating intern. James, our previous resident, now PhD, he does the work with the sea turtles. Toby and Claire, our current residents, who do specialization in cardiology. Then Ananda, our previous, who's now a cardiologist in Toronto. She still does a PhD with us. Megan, our previous master student, and Ritu, our current PhD student. And then just briefly, other things you do when you are a veterinary cardiologist or a specialist, and that depends also on how much you want to become involved. So we just recently founded last year, the Canadian Veterinary Cardiology Network, which is really the idea of bringing people who like to do cardiology, who do cardiology together over Canada, because it didn't really exist before. And again, like you can imagine, or if you do something, everyone does their own things in a way, even if you have learned about it, to exchange ideas, to support and help each other. Then Tammy has mentioned it already, so I'm at the moment the chair of the ECVIM specialty in veterinary cardiology. I am involved and have been involved in the board examinations, so the specialization examinations you do at the end of your training for the last over 10 years. I'm a board member of the European Society of Veterinary Cardiology. So what does it mean? We organize, there's a European and American Congress every year. So we are organizing the cardiology part of the European Congress. So it's again like, being involved, giving back. I'm a co-editor-in-chief of the Journal of Veterinary Cardiology. So again, research, but also clinical cases that get published. And then we also have the initiative of feline friendly, so in the hospital trying to make cats more, it's nothing directly to do with research, but trying to feel cats more comfortable. Same for the dogs, but they're usually easier when they come into the hospital. So my take-home messages for today, so it's not really cardiology associated, it's more giving you possibly a bit of an encouragement that, you're at the beginning of your career, the world is your oyster. I think everything is possible and you have plenty of options. So don't think like if you have one decision that will be for the rest of your life, life is usually not straightforward, but it also mean it as an encouragement. Don't think when you have made a decision that you then feel like, oof, that was a stupid idea. It might benefit you later. So nothing is really wasted, I feel. So yeah, no decision is final. Who knows? It can be, it's your decision. It can be final for you, but don't, things come up with time. There are other options in case it didn't work out as you felt, or things, don't go at that time point how you thought they would go. If you can do whatever you want to do, but you need to work. I think it's really an important message. If you are super smart, you might not need to work, but if you're normal, you need to work to achieve what you want to achieve. So I can only encourage you to be the best you can be. And it's really nice. I can only tell you it's super satisfying to be able to work on a level where you can provide, you do the best you can do. You provide the best care you can do, or you be the best in your job as you can be. It's a really nice feeling. Yeah, be curious about things and open-minded. That opens door and gives you options of maybe sometimes things you haven't even thought about it before. It's not always easy, as you will know, but it's usually never boring if you explore different things. And then the other thing is also, it's really, or what we are now at, it's really, when you're at a level, it's really nice also to share your knowledge, to teach other people, to make them better in your subject. It's something which is really nice also. Okay, that's all I had. Thank you.